Please welcome to the stage the Leadership Discussion Panel moderated by Charlotte Sutton, Health and Science Editor for the Philadelphia Inquirer.
Good morning, everyone. It's great to see such a wonderful and engaged audience for this important topic. As you just heard, I am the Health and Science Editor at the Philadelphia Inquirer, and we run our coverage of the opioid crisis out of the Health and Science desk. Our lead reporter is Audrey Whalen. I think many of you know her name. And it's very intentional that we run it out of the Health and Science desk because this is a disease just like cancer, diabetes, anything else. And there is science. We have excellent science that's getting better all the time. So I'm really honored to be here on this day of such hopeful messages. I'm going to briefly introduce our panel members. Their full biographies are in your packets, and they all have such interesting and exciting backgrounds. I hope you get to read them all. Immediately to my left, we have the Surgeon General of the United States, Dr. Jerome M. Then we have Luke Gorman, who Patrick talked about so movingly in his remarks. And he is co-founder of the Flock at St. Joseph's University and is himself in recovery. And finally, we have the man who made all this possible, Dan Hilferty, the president and CEO of Independence Blue Cross. Let's start out by hearing everyone talk about what the phrase "someone you know" means to you in your personal life. Do you want to start us out, Dr. Adams?
Absolutely. I'm an anesthesiologist. I'm trained in acute and chronic pain management. I went to medical school during the era of pain as the fifth vital sign. And to be honest with you, I was part of the problem. I was told that opioids were non-addictive as long as you were giving them for pain. It didn't matter how much you gave out. And saw this evolve in my professional capacity as a clinician. As many of you know, I also was the health commissioner in Indiana when we had to deal with the largest HIV outbreak related to injection drug use in the history of the United States related to prescription opioids. And so I've also dealt with this from a public health capacity. But today was special for me because it's been hard to talk about my brother, Philip. But my baby brother, Philip, is in state prison in Maryland. He had unrecognized, untreated mental health issues, anxiety, depression. Like so many folks, he self-medicated with tobacco, alcohol, marijuana, and then one day someone gave him a pill. And that really accelerated his slide. He then went on to injecting drugs and stole $200 to support his addiction and received a 10-year prison sentence. And I don't share that story to evoke sympathy from folks, but I do share it because I know someone, and I know someone very personally. And if this can happen to the brother, to the family of the Surgeon General of the United States, it can happen to any of us.
Thank you so much. Luke, can you share your story with the audience?
So being a person in long-term recovery, someone I know is just about everyone that I know. I think it's incredibly important to build a life in recovery, and that's what I did. So I have tons of relationships in the recovery community, and a lot of the best people I know in this life are people who are in recovery. Patrick is somebody that I know. Patrick is somebody that I love. And we've built an incredible relationship that never would have taken place had we not had the opportunity to get into recovery.
Thank you.
Charlotte, well, first of all, thank you for being here today. Just the work that you do with the Inquirer in making people understand this dreaded disease is to be commended. We really appreciate it. Dr. Adams, as I've read more about you, and certainly to hear your story on the stage here today, your focus on partnership, regardless where you can find that partnership, is so heartening to us at Independence and at our foundation, and we applaud you for the work that you're doing. This guy to my right, Luke Gorman, who I believe the entire Gorman family is here today. I'd like to welcome you. Luke, there they are right there. I've gotten to know Luke because someone you know is my son, who is about to celebrate 5 years in recovery. My beautiful wife, Joan, and I are so proud of everything that he's done and the leader he's become, like Luke and Patrick, in building, throwing the pebble into the pond and letting the ripples grow and bringing more and more into their network, more people who become disciples and then lead their own group to the promised land of recovery. So it's very close to home for me in that regard. And I believe that for whatever reason, in part, this happened because of the role I've been able to play at Independence Blue Cross and these incredible colleagues who are around me, who are just not traditional health insurance executives and health insurance workers. They are about the people we serve. And we tend to go wherever there is crisis. And I think from this panel and the discussions that you'll hear throughout the morning, we are in crisis. And where there is crisis, you will find independence. And therein lies the partnership that we hope to continue to build with you, Dr. Adams. So thank you, Charlotte.
And I thank you and Luke for sharing your stories. You know, you got the bookends. And it's important as we go through today that we remember someone you know is about someone who suffers from addiction, but someone you know is also about someone being in recovery. It's easy for us to get bogged down with the terrible statistics, the overdoses, the hepatitis rates, all the sequelae of addiction, but it's important that we always remember that there's someone you know in recovery. You just may not realize it, as Patrick demonstrated when he came out. And there is hope for this crisis. Addiction is a disease, but it's important to remember that addiction is a disease with effective treatment and effective recovery.
Thank you for that reminder. We're next going to talk about priorities, and since we've been talking about recovery, it seems to make sense to go straight to Luke. Luke, can you tell us about the flock and how that came to be and what role the recovery community is having in your life in recovery?
Absolutely. So the flock is a collegiate recovery program at St. Joseph's University where I went back to school after getting sober. And I had the experience of spiraling downward in addiction on a college campus, which was St. Joe's University, and then having the incredible opportunity to go back to school as a person in recovery. And when I went back to school, it was my hope that I could start something there that would help people who had struggled with addiction, personally, and others whose lives had been affected by family members' addictions and things of that nature. So with another individual on campus, a dear friend of mine who's in the audience today, and a great deal of help from the administration, particularly Katie Bean, who may be in the audience here today, who made it possible for us to start this program at St. Joe's. We just began to build something without really knowing what we were doing, without a great blueprint or anything like that, but as people who were in recovery, who wanted to advocate for other people in recovery and start a grassroots organization to create a safe place on campus.
And I have a follow-up question. We were talking backstage, and you said that you once thought that you could never come back to Philadelphia when you were in recovery. And a lot of people do believe that when you're in recovery from any kind of addiction, you need to go to an entirely new environment and get away from the environment where all this started. What was different for you? Why did that not prove to be your situation?
I would say I think that Philadelphia is honestly at the epicenter of the opioid epidemic. I think there's no doubt about that. And if you read the news, particularly if you read the New York Times, the most widely distributed paper in America, what you see is just one side of the story. And that's what Kensington looks like, a neighborhood in North Philadelphia, just a few miles up Broad Street here. And there was a point in my life when I had left Pennsylvania and I had moved out to Colorado and was trying to put my life back together. And I did not think I would ever be able to come back here and live a happy life. And it turns out that was a fallacy. And when I moved back to Philadelphia and got back into school, started to rebuild relationships with my family, and really become entrenched in the recovery community, I learned that absolutely anything is possible. And like Patrick said, my main agenda is to destigmatize addiction and say that I'm somebody you know. There are a lot of people in the audience who are somebody you know, and we're proud to be in recovery.
Excellent, thank you. Dan, can you talk about your priorities, both as a dad and as a CEO? What do you consider top of your list?
So Charlotte, first I'd like to address it from a corporate perspective and in, not only in the healthcare industry, but in the managed care industry. For those of you that run businesses, for those of you that work for a large company, a mid-sized company, a small company, I ask you to go back to your employer and demand that they get a contract with qualified facilities like Karen, where workers will be free to go and know that they are covered by their insurance company. I'm proud to say that Independence Blue Cross is one of the first companies in the country through a number of our products that provides initial 30-day coverage, and working with our medical team, works with the facility to consider what is the best next step for the recovering addict. Every single American, be they employed, be they part of the exchanges, be they in Medicaid or Medicare, should have the ability, if needed, if persuaded by others, to get full recovery services. That is a priority for us. That's why our STOP program that Steve referenced, which is the umbrella of our continued efforts around the opioid crisis, and our warm handoff program, working with various counties, various health facilities to make sure when people are in crisis, they get to recovery. So that's kind of at the large corporate level. At the next level, when you look at, we decided working with our facilitated health networks team, Dr. Tony Coletta, the president, Dr. Rich Snyder, the senior vice president, Tim Wadsworth, that we were going to focus on working with the medical community. Since 2014, we've seen a 45% reduction. That's 450,000 members who are not prescribed an opioid. We've seen a 35% reduction in the number of prescriptions for opioids. That's incredible, folks. That's a step in the right direction. And if we can expand other insurers, competition's one thing, but we'd love to be a beacon for other insurers to build these partnerships with their community. And Dr. Adams, from a CDC perspective, we have taken the guidelines and gone out to over 1,000 physicians in the 5-county area and helped educate them. Combine that with a 5-day maximum for initial prescriptions, and there's a discussion about this issue. You know I'm going on, but let me just finish that. The key point from a personal perspective and the journey that I'm sure Luke's parents have been on, Dr. Adams, you and your family have been on with your brother, Joan and I and the rest of our family have been on with our sons. The key point here is that every single person who is struggling with this disease, you never know. You never know when a family member reaching out and embracing the individual, like Patrick's sister, it started to germinate for him. So it's about each and every one of us building a community. It's about each and every one of us, one addict at a time, embracing them and sending them on to embrace the next one. And the ripple effect will be monumental. And to me as a father, to me as one who has this fortunate role that I serve, that is the most important thing, because programs, whether they be government, private sector collaborations, programs are important. But at the end of the day, it's that individual human contact, an embrace that we give each and every one battling with this disease that will enable us to overcome this dreaded epidemic.
Thank you. And I have a follow-up question. You spoke about access to treatment, which is certainly incredibly important. But it's striking to me, the American Society of Addiction Medicine this week came out and said, we need some way to show people that the treatment that they're going into is quality. And also another issue is length of treatment. For a lot of people, 30 days just isn't enough. How does one, from a corporate perspective, deal with two potentially very costly issues, and that is ensuring quality and also ensuring an adequate amount of treatment.
So, Charlotte, thank you, and I will be briefer on this one. Let's start at the finish line. The finish line is where we can prove, we can show the evidence that by getting someone into treatment early, whether it be 30-day, a 90-day extended stay, some other type of situation post the 90 days, that in fact, the actual medical costs go down. And we are working with Karen, our team, again, Dr. Coletta and others, working with the folks at Karen to do a study to tell us just that. Because then we believe that that upfront expenditure, insurers working with the provider community, that upfront expenditure that seems very large, ultimately will mean less medical costs down the road. That's the ultimate goal here. And then I think we'd rid ourselves of the reluctance to insure whatever services are needed. That's going to take time. We encourage other insurers, other providers of services and facilities to do the same. That would be the first. But in the interim, it's again, one of our members at a time, working with their support network, if they have one, to make sure that they get the best care possible.
And to piggyback on that, we recently released from my office a spotlight on opioids. Anyone hear about the Surgeon General's report on drugs, alcohol, and health that came out in 2016? Raise your hand if you heard of that report. It was a landmark report that my predecessor put out. Now, raise your hand if you read the whole thing cover to cover. About this thick. But what we did to make that more accessible to folks was to distill it down to about 25 to 30 pages that you can read in an hour. And in there, it talks about the science of addiction. Addiction is a brain disease. It talks about medication-assisted treatment. It talks about harm reduction. But it also talks about the ways to determine whether or not a treatment program is an effective and laudable treatment program, because there are a lot of programs out there that are not evidence-based. So I would encourage everyone in this audience to go to surgeongeneral.gov, take an hour. Can you spare an hour to save a life? Can you spare an hour to become informed? Can you spare an hour to help get individuals into recovery? And read that spotlight on opioids so that you can be informed, because there's nothing more powerful than an influencer, and all of you all by nature of being here are influencers in the community. Nothing more powerful than an influencer armed with the appropriate information. Nothing more dangerous than an influencer armed with inaccurate information or without the full picture. So that's number one. Number two, we also released a spotlight on opioids, and I think all of you all got a handout of that. Did everyone get a card or a handout? If not, then you will get one. But about 30 years ago, C. Everett Koop, anyone remember that guy?
Yeah.
He released a pamphlet across America called Understanding AIDS, because we had a crisis, and that crisis was becoming worse because of ignorance and because of stigma. He wanted everyone across America to understand how they could respond to the AIDS epidemic. Fast forward 30 years, well, I've put out our 21st Century Advisory, a digital postcard detailing 5 steps that everyone can take to respond to the opioid epidemic, because everyone does have a role to play, but they need to understand what they can do. And these are steps everyone can take within their communities to respond. Talk about pain, talk about opioids, be safe, making sure you're securing your opioids, because 4 out of 5 heroin users got started with a prescription opioid. And while we're doing better on prescribing, we are still 3 times what we were in terms of opioid prescribing in 1999. We still have a long way to go. Understand pain. I'm so glad you mentioned that you're focused on decreasing prescribing, because again, 4 out of 5 got started with a prescription opiate. But if we don't replace it with some other adequate form of pain management, folks are just going to play whack-a-mole. They're going to jump over to something else. We've got to make sure we are providing and paying for evidence-based solutions to treat pain that aren't opioid-based. Know addiction, know that it is a brain disease, and then finally, be prepared, be willing to carry naloxone. So, what's daunting about this opioid epidemic? And I always think of that old saying, how do you eat an elephant? One bite at a time. This opioid epidemic is like an elephant sitting in front of all of us. And when we look at it, we just go, there's no way I'm going to be able to eat that whole thing. I might as well just give up. But it's all of our jobs to show everyone how they can take a bite of that elephant. And if you tackle the nose and you tackle the tail, and I tackle one foot and you tackle another foot, then pretty soon we'll have that elephant eaten. And that's really what I'm trying to do as Surgeon General, is give folks the education, the tools that they can bring to bear to be part of the recovery response.
So Charlotte, just in terms of hearing Dr. Adams speak about the relationship of the provider community with those of us in the insurance industry, government does an incredible job of rating the effectiveness of individual clinicians and systems as a whole. I think we need to be better together at telling the story about the facilities and the programs that work and those that do not, and making sure that our members, our patients, have a clear understanding of what the best opportunity for recovering is for them. I don't know, Luke, for you.
I wholeheartedly agree.
Great. Dr. Adams, as a physician on the panel, something I've wondered about as well is what can be done to better help physicians? Because this has got to be an incredible challenge when a physician suspects that they have a patient who has this problem. And I, for one, find it really ironic that any doctor can write a prescription for an opioid painkiller, but you have to jump through a few hoops in order to prescribe medication-assisted treatment. What could we do? What could we be doing on a policy level to help doctors?
That's a great question, and I'll try to be brief because it is an hour-plus lecture that I give when I go around talking to providers, but we're trying to provide guidance. Remember when I said there's nothing more dangerous than someone who's not armed with the facts? Well, we can't assume that every doctor, that every nurse, that every pharmacist out there understands the science behind addiction. We've got to make sure we give them guidance like the CDC prescribing guidelines, like the spotlight on opioids, like guidance on co-prescribing. Do you know that less than 1% of people who are clearly at risk for overdosing from prescription opiates are co-prescribed naloxone? You know, there's a lot of low-hanging fruit out there, and we're trying to go after that by arming physicians with the information, with the tools, with the resources that they need. We're also working with employers, with companies, with insurers to make sure we're paying for the appropriate treatment. Dan alluded to this, but one of the big problems was we've been willing to pay for opioids for years. You know it's interesting. We think of drug dealers as these terrible, horrible people who are killing our kids. The first drug dealers that most people run into are grandma, their aunt, their uncle. There's someone who's gotten 60 Vicodin and left them in the cabinet so that they can be diverted. And if we go further upstream from that, you know who the first drug dealers are? They're the insurers. They're the people who pay for those pills. And I don't just mean the private insurers, across the board. We need to pay for the solutions and not for the problems so that we can incentivize folks to do the right thing. And then finally, there's some responsibility on everyone out there too. This is a demand situation. If you come into a doctor's office and you demand opioids and the doctor says no, but you can go to doctor after doctor after doctor, eventually you'll find someone who says yes. We need folks to be informed about the dangers of opioids and about the alternatives that exist and demand those alternatives, and eventually providers will start to prescribe those alternatives and insurers will start to pay for those. So again, everyone has a role to play so that we can use that touch point of the physician encounter, of the provider encounter, to, again, do the right thing and incentivize recovery and prevention versus to do the wrong thing and incentivize pathways to addiction and inadequate pain management.
So thank you. I would like to ask about a priority for a lot of people in the harm reduction community here in Philadelphia. You've heard us called the epicenter, and we are indeed. We lost more than 1,200 people last year to addiction. So there is an effort afoot to open up what, depending on where you fall on the spectrum, you think is either an important public health measure to save the lives of people who are not yet ready for treatment and recovery, or else you think it's just a terrible idea that is sanctioning drug use. And this, of course, is supervised injection sites. So I'd like to open this up to the whole panel. Luke, you and I had an interesting conversation about your thoughts on the topic. Do you want to talk a little bit about that?
Sure. I think over 1,200 deaths last year is an astounding number, and I hope that that's not the last time that you hear that number today. And it's something that we need to keep in mind. And I sit here today for my friend Tom, who lost his life to a heroin overdose in 2015. and many, many more that followed after that. And I agree with the idea of a safe injection site. I think the data is good. I think the idea is to stem the tide of bodies. And it's my personal opinion that that would be an incredibly effective measure to save lives. And I think right now, with the epidemic and the proportions that it's reached, saving lives should be in the forefront of all of our minds.
The other thing, Luke, that you told me that I thought was quite interesting, there are a lot of people who think a supervised injection site would be located in Kensington, where there are, unfortunately, a lot of people who have lost their homes, their jobs, their families, everything to addiction, and they're living on the street. But you were telling me, no, that's not the case. People who haven't lost everything could still use them. Can you explain that to the audience?
Kensington is the hub for drug traffickers all around, and I think not just people who are on the streets, but people who are from the suburbs are driving to Kensington to purchase narcotics. And it's not just the people on the street. Someone you know means it could be anyone. That's one of the things about addiction is it's an incredible leveler, and it does not discriminate against race, creed, religion, sexuality, or any of those things, and it affects every community in an equal way. And it's just a very powerful force, and I'm incredibly grateful to be sitting next to the Surgeon General of the United States and the CEO of Independence Blue Cross, who I've gotten to know on a personal level and who's mentored me since I was early on in recovery, and he believed in me, and thank God for that. And my mom's out in the audience today, and I know without a doubt that I wouldn't be here today if it hadn't been for my mom, because she never gave up on me, and she never lost hope, even when I had myself.
Dr. Adams, I know you've got different views on the topic of a supervised injection site. Can you share with the audience what your thoughts are?
Well, I would say first and foremost that we have to be careful about terminology. And some folks call them supervised injection facilities. Some folks call them safe injection facilities. I will tell you from a physician's point of view, there is no such thing as a safe injection facility. You can still die, you can still get an infection, you can still get endocarditis, you can still have negative outcomes even when you're injecting in a supervised setting with illegal substances. And so it's important that we don't give the impression while we're trying to push for an intervention that there is a safe way to inject. That's why we call it harm reduction, because harm still exists. We're trying to reduce harm. So first and foremost, I think that's important. But as I travel around the country, everyone's having a conversation about what the opioid epidemic is doing to their communities, what it looks like, and how to appropriately respond. And what I would say on the topic is that there's still a lot of low-hanging fruit out there, a lot of evidence-based interventions which have been accepted by the community, in large part because of a lot of the hard work that you all have done in this audience that still need to be optimized. Medication-assisted treatment, availability of naloxone, even syringe service programs, where I was in Philly just a month ago, and folks were telling me that the syringe service program here, while one of the largest in the country, still doesn't operate on a continual basis. And I'm proud to say that the federal government now provides support for syringe service programs as a touch point and allows states to use their funding. So as Surgeon General of the United States, I'm pushing for us to go after that low-hanging fruit, build that base, and then continue to just have discussions about what's going to work. But let's be careful about getting distracted with controversial interventions that pit people against each other when we haven't first optimized the evidence-based and universally supported interventions that many of you all fought hard to get to the point where we can say that they're evidence-based and I say universally supported syringe service programs. We're still fighting to get folks to accept that across the state, but at least we're further along on that than what we are on other topics. And so it's not to let's crawl first before we try to figure out how to sprint, particularly on controversial policy solutions where the Department of Justice has weighed in on the issue and said that we consider these to be a violation of the Controlled Substance Act. So that was more than what I intended to say on the topic, but I know it's important to the folks here in the audience. And again, go to the postcard. Be safe. Be prepared. Carry naloxone. Talk about medication-assisted treatment. Talk about other touch points that you can optimize so that we can, again, build to a place where we've said we definitely have done all the things that we could do at this point to respond to the opioid epidemic before we start exploring other things where there's a lot of controversy and, quite frankly, you're going to get a lot of the community against you.
Thanks. Dan, from the corporate and community leadership perspective that you hold, given the rate of deaths that we've had, do you think it's time to do something? As some people think it's radical, some people think it makes sense. Where do you come down on this?
I was half hoping, Charlotte, you would move on to the next question.
I know you would.
But
You were more than half open.
I was saying,
everyone's
Dr. Adams,
together.
Yeah. But I got the hard one.
Now, here's what I believe. Government needs to weigh in aggressively on what are the best ways to help folks, whether they be on the street or in the home, get the recovery treatments that they need. It's not up to us to make a decision whether we're pro safe injection sites or we're opposed to safe injection sites. We just want to create a web as a company connected with other partners to catch every single person that we can and help them find that right path to true professional services and treatment. And I have to say one other thing on the subject. When we first were introduced to this dreaded disease, it was in Scranton, Pennsylvania. And Patrick Flynn is from Scranton. But on a Thursday afternoon, or someday Thursday, the train station would be filled with mainly young people coming into town with backpacks full of drugs. And I firmly believe that supporting government, supporting law enforcement, we need to go back to nipping this in the bud and making sure that every opportunity is taken to stop the flow of drugs to a Kensington or to the hot spots. Now, what that will do may cause problems for those who are suffering from addiction, but it also might give us an opportunity to expose them to the net and then put them in the type of care that they might need.
And I love that you talked about the net, because that's really what it comes down to. It's, are we optimizing touch points? You heard so many stories of recovery, but what you didn't hear when we were talking in the back with folks is, I asked, what was your epiphany moment? What was your either rock bottom moment or your incentive to get into recovery? And we heard some powerful, powerful stories, but we want to make sure when folks are ready, when they've reached that point, that they can access services, that we've created a touch point where when Patrick says, I've had enough, that we can immediately get him into treatment and long-term recovery services, whoever the Patrick is that you know out there. And that's what I really want folks to focus on, is figuring out how you, each and every one of you, can be a touch point for someone, can be that intervention point that helps them get onto the road to recovery.
Right. I think I can say pretty confidently that everybody in this room is on board with the fact that addiction is indeed a disease. However, in a lot of ways, a lot of our elements of our system still treat it punitively. And as a result, we have folks like your brother, unfortunately, who come in contact with the criminal justice system. They serve their time, they come out, and they can't get a job because nobody will hire them. I just bring that up as one example to open a discussion of how can we better align the various elements of our society and of our government and of our corporate community and of our public attitudes to help more people find the kind of lasting recovery that Luke fortunately has?
Well, number one, we have both a financial and a workforce imperative to address the opioid epidemic, even if you don't care about the individuals. And I hope that everyone in this room cares about the individuals as deeply as I do. But even if you don't, there are other reasons, imperatives to care about the opioid epidemic. We now have 6 million unfilled jobs in this country. And for the first time in a long time, we have more unfilled jobs than what we have people looking for work. That means our economy is potentially going to stall if we don't figure out a way to reintegrate a lot of these individuals into the workforce. And when you talk about my brother, it costs $100 to $200 a day to incarcerate someone. Times 365 days a year, times 10 years, means you all, as taxpayers, are going to pay upwards of $500,000 to $1 million to incarcerate him. So even if you don't care about him as an individual, even if you don't care about him at all, do you want $500,000 to $1 million of your money going to incarcerate him simply for him to come back out and get back on the hamster wheel all over again because he can't get a job, he can't reintegrate into society? So tell a really short story about a place I was just a few weeks ago with the second lady, Mrs. Pence. We were at Belden in Indiana. Belden's a company that's been in a community for 80 years. It's being plagued by the opioid epidemic. They had to bring in 300 people who had already successfully put in an application and already successfully interviewed, but they had to interview 300 of those people to fill 50 positions because so many people were failing the drug test. And they finally said there's got to be a better way. And again, they did it because they had strong leaders like Dan as part of the company, but they did it more so because of the economic imperative, the waste that came from having to go through that many people to hire someone, and the fear that next time they were going to have to interview 500 or 1,000 people to get 50 people. So now they drug test folks right up front before they do any interviews or anything else, but they tell them, if you fail the drug test or if you tell us you have a problem with substance misuse, we will connect you to treatment that is funded. And if you're successful in treatment, then we will keep a job for you. And so it's an innovative new program. They've had tremendous success so far. It's saved them a lot of waste. The people who've made it through the program are some of their most loyal employees. And there was a great quote that Devin had in his piece out front, if you get a chance to listen to it. But it says success in recovery is directly dependent on having a life after recovery that you can envision that is hopeful. Mm-hmm. And so these individuals, when they know they have a job waiting for them, that's one more reason for them to stick with it on those really tough days when they're in treatment and when they're in recovery. So there is a better way to attack this problem. We just need to help folks understand that, yes, whether you personally know someone or not, and we know that over half of the country does, that it is affecting you, and that there are ways you can lean into it. And even if you don't care about these folks on an individual level, you better figure it out from an economic imperative and workforce point of view.
Yeah. Thank you.
So just a quick point to add. We as a company, first and foremost, we have a number of affinity groups, folks of all different cultural, society, life experience come together. And we trumpet as part of our rules of the road, we call them, that we will be a safe haven for folks. And what this whole program today is about, someone you know, is beginning to break down significantly the stigma of addiction. And so I want to just point this guy out. Luke and I got to know each other through my son as he was really getting his life together. And from the first time I met him, and we would meet, Luke, every month or every 6 weeks or so, just to talk it through, and we came up with a process for him to figure out where he needed to go. And so I decided at that point that a small role that I could play, Luke had other dreams, and he's chasing those dreams, and he's now thinking of a new direction potentially to chase those dreams. But we have an opportunity as a large company, and I have an opportunity to, when I meet a Patrick Flynn and find out what Patrick's, his love for public policy and government affairs. Well, he belongs at Independence Health Group. And for a number of years, even some of his colleagues here today didn't know of Patrick's journey. But if we can be a safe haven for those, whether they were incarcerated, whether they had a bump with the law, other things that they had to overcome, if a job fits them, they should work with us. And more companies, I hope at some point that we can trumpet the success of it. You have to be careful because folks sometimes want to be anonymous about their situation, but as more are comfortable with sharing their story, as Luke and Patrick are, we need to find opportunity for them. And this guy is a hero of mine.
Well, and speaking of Luke, I was going to direct the final word on this topic to Luke. Luke, you shared with me that you made several attempts at recovery, as many people do. On your journey through recovery personally, and also as you've been helping others, have you seen different elements of our system kind of clashing with each other and being counterproductive, that, changes that could be made to make the situation easier for individuals trying to get through?
So I think my perspective today is that of a person in recovery. I'm not a policy expert. I'm not a PhD. I'm not an MD. I'm a person who's in long-term recovery, and I'm an advocate for others who are in long-term recovery. And what I believe is that we need to shape and create a future in which we are not afraid to be open about our recovery. And what I can say, having lived this life for a number of years now and having made incredible connections with incredible people, is that we are strong and we are resilient and we are brave and we're out here and we want to help and we want to contribute to society. And I think out of this epidemic, one of the things that happen is that people who come out on the other end of that come out with an experience that they can use to help others. And I think that's my job today, is to sit here and just say I am a person in recovery. And I hope that everybody who's in this audience today, you're here for a reason. And I hope that you can leave today with a little bit more knowledge and information about what recovery looks like and implement that into your lives and give opportunities to people who need them. Because when I sat down with Mr. Hilferty for the first time, I was delivering pizzas, and I was going to school and I was just trying to put things back together and I had no clue where I was headed. But what I did know is that both my feet were firmly planted in recovery. And this gentleman gave me the opportunity to sit across from him, and he believed in me. And that changed the trajectory of my life undoubtedly. And it's my job to turn around and try to do that for other people and say that we have miles to go, but we've made an incredible start. And I love recovery. This is my life.
And it really is so I'll tell you, even as a physician and as a public health advocate, there are days that I constantly wonder whether my brother will ever dig out of the hole that he's in. There were certainly darker days before I got in this job and got to travel around the country, because unfortunately we don't hear those stories of recovery. We just hear the stories of despair. And seeing and talking to you, getting to meet folks like you all, has helped me as the Surgeon General of the United States be able to be more open about my own brother and have more hope and faith that my own brother will someday be sitting on a stage next to someone else sharing his story of recovery. So thank you so much, Luke.
Thank you.
My final question, as our clock is winding down, it almost seems redundant since our whole discussion has been on this, but final question here is, what can we all be doing to inspire more hope in the face of what remains a really terribly daunting situation? So if anyone has some final thoughts on that topic, what we could be doing, please.
Well, 20 seconds, number one.
There you go.
Go to surgeongeneral.gov, look at the postcard, share it on Facebook, on Twitter. Every single one of you all who has a social media account, really, go to the website and send this out to all of your friends, because this is something tangible that you can do to respond to the opioid epidemic.
Great.
And I would ask that anybody who's in the audience today, please just try to show compassion and love for individuals in your lives who are affected by this crisis, because it can be a really bumpy road, but there's a lot of beauty on the other side.
And I would just close from our vantage point to say, like Luke, come, volunteer, be part of helping us build this web, catch people and help them find their way to recovery. And I just commit on behalf of all the Associates of Independence Health Group, we will be in the forefront of calling out the issues, of creating this web with our government partners, with our provider partners, and we need as many troops as we can. And Dr. Adams, we are so appreciative of you being here today, and your message of hope is one that we will all carry with us for a long, long time.
And I ask all of you all to carry that message too. Find your Luke, find your Patrick, and I mean that very literally. Find someone whose story you can share that will instill hope in others, because as I shared with you, sometimes even the Surgeon General needs to hear those stories so that I can continue to have hope in the face of some of these harrowing statistics. But recovery is possible. It's right here in front of you, right in front of our eyes.
Yeah. Yes, sir.
Thank you so much to all the members of our panel, and I'm sure that you all will have a terrific and very informative morning. There's a great program ahead for you all. Thank you so much.
Thank you. Thank you, Charlotte.